Hello there. Thank you for tuning in to Town Meeting TV. My name is Bobby Lussier, and today I'm joined by Charlotte McCorkel, who is the Senior Director of Client Services at the Howard Center, to talk about a new program that the Howard Center has just launched, the Mental Health Urgent Care in Burlington. Is it in Burlington?
That's right. Yes, it's at 1 South Prospect Street in Burlington.
Awesome. Thank you so much for joining us today,
Thank you.
Charlotte. Really appreciate it and appreciate all the work that you're doing for our community. Could you start by just introducing yourself, share a little bit about how what your position does at the Howard Center and how long you've been there?
Sure. My name is Charlotte McCorkel. I'm a licensed clinical social worker, and my role at Howard Center is Senior Director of Client Services. So I support agency-wide initiatives and projects, and I was co-lead for the Mental Health Urgent Care project. And we just opened the program on October 28th, so just 2.5 weeks ago, but it's a project that's been a few years in the making.
Awesome. Congratulations. I'm sure it's an exciting time for this project to be coming to fruition. You mentioned that you have a degree in social work. So you've worked at the Howard Center directly with clients before this leadership role?
I have. I started at Howard Center in 2008 as a senior clinician in what was then a children's crisis program. And then I became a supervisor and then program director. And then about 8 years ago, I led a project to merge our 3 distinct crisis programs at the time into a new program, which is now First Call for Chittenden County. So that's a 24/7, 365 mobile crisis team. There's crisis teams in all of the counties in Vermont. And so First Call serves Chittenden County and has a 24/7 phone number, 802-488-7777. And people can call if they're needing crisis support. And then First Call can help to understand the nature of the crisis and provide mobile response anywhere in Chittenden County. So I started at Howard Center doing crisis work, which is, I hold dear to my heart. I think it's a wonderful type of social work. And the philosophy at First Call is the caller defines the crisis. And it's a similar philosophy at Mental Health Urgent Care. If it's a crisis to you, it's a crisis to us, and we want to provide support. From that crisis role, I moved into an agency-wide role looking at our access and intake programs and creating one point of entry for folks in our community looking for Howard Center services, and that became our access and intake program. And so if people are looking to become a Howard Center client, they're not in crisis, they can call 802-488-6000. So we're trying to create numbers that are easy to remember and user-friendly. And someone can have a screening by phone and schedule an intake assessment. And so then since, let's see now, for about almost 6 years, I've been the Senior Director of Client Services.
And in your leadership position there, how would you characterize the ways that the Howard Center has evolved, especially in the past few years, as the circumstances related to folks in crisis has really changed?
Yeah, it's a great question. Howard Center's a very large agency. We're considered what's called a designated agency. So we're designated by the state of Vermont to provide services in our community. And Howard Center serves our community through the lifespan. We have early childhood services. We have a clinician in every public school in Chittenden County. We offer outpatient services and residential care. We have an elder care program. And we serve children and adults who are facing mental health challenges. We provide support for people with intellectual disabilities through our developmental services program. And we provide support for people with substance use disorders who are looking for substance use treatment as well. And the needs in our community are great, and Howard Center tries to evolve and adapt to meet the ever-changing needs. So one example of that is in Burlington, we have a long-standing street outreach program, often very visible on Church Street and in the surrounding area, serving all of Burlington. And a few years ago, we created what we call the Community Outreach Program. So other towns surrounding Burlington have outreach support as well to provide that emergent intervention, to be present and supporting law enforcement and emergency responders and to help support people in the moment so that they don't have to go to the emergency department or so that their crisis doesn't get worse.
Right. And so we'll get into this program that's just launched in a moment. I'm curious also, you mentioned the supporting law enforcement. What does that look like, Howard Center's relationship to local police departments?
So we know that many of the calls that go to 911 or local police departments are social service related calls. And so we have strong relationships with law enforcement, local police departments, and the state police so that we can partner with them to respond to those social service needs so that the police aren't responding in those moments, but a Howard Center staff, like an outreach worker or a social worker, are responding either with the police or instead.
Right. And so there are times when someone calls 911 and it's actually a Howard Center worker who's responding to that call ultimately?
That's right. So if someone calls 911, it's pretty typical that the police respond to make sure a situation is safe for staff to respond. But then a member of our outreach team could respond to help provide an intervention, to help gather more information and connect people to needed services. Or from that emergent 911 call, after the police respond, it could be that first call for Chittenden County is called and a mobile response is determined to support the crisis situation.
Okay. And so let's talk about this new program which is just launched, the Mental Health Urgent Care Downtown. Can you just share a little bit about how this idea came to fruition and what this program looks like?
Yeah, definitely. So in 2022, it was very clear that many people were going to the emergency department at the University of Vermont Medical Center with mental health crises or with unmet social service needs. And there were days where there were more than 10 people in the ER waiting for mental health treatment or support. And sometimes they were there for many, many hours, and sometimes waiting for support for more than a day. And it became clear that we needed to provide more alternatives to the ER in our community as a whole. So not seeing it as a responsibility for the hospital to figure out, but really a community problem of what else can we do so that the ER is not seen as the answer. And at the same time, the Department of Mental Health in the state of Vermont was looking at its crisis system as a whole. And so in Vermont, there are mobile crisis teams, like I mentioned, and there are call centers through those crisis teams to get local support 24/7. A couple years ago, 988 also launched. And so this is a universal number anywhere in the US that people can dial instead of 911 if they're looking for crisis support or suicide intervention rather than calling 911. And so the change with 988 meant that people had a place to call, and it meant that someone could receive a mobile response in their homes or in their community. But it still left a gap where there wasn't a place where people could go that was feeling safe or therapeutic if they were in crisis. And that's why we were seeing people ending up in the emergency department. So in 2022, the state of Vermont, through the Department of Mental Health, issued a grant announcement for funding for mental health urgent cares. And the mental health urgent care that Howard Center just opened in partnership with UVM Medical Center, Pathways Vermont, and Community Health Centers is actually the 4th mental health urgent care in Vermont. So there's one in the Northeast Kingdom, there's one in Addison County, and there's one in Washington County. And they all look a little different. They're all run by their respective designated agencies. And so this funding opportunity through the Department of Mental Health is what kind of sparked the reality that we could make this alternative to the ER possible in this community. At the same time that this funding was announced, there was a group of community leaders that really started a grassroots movement to identify alternatives to the ER. And they brought together leaders from a number of different agencies to look at different models and look at national best practices for programs that were alternatives to ERs in different communities. And so the stars kind of aligned with the grassroots community leaders and this funding opportunity coming together. And so Howard Center submitted a proposal to the Department of Mental Health for mental health urgent care. And knowing we couldn't do it alone based on the really diverse needs in our community and also our staffing challenges. And so that first request for funding was in partnership with University of Vermont Medical Center, Pathways Vermont, and community health centers so that these community partners could all work together and have a part in developing a mental health urgent care program. And we heard back from DMH that they were funding the program. We were very excited about that, but based on limited resources, they were only able to fund a portion of the whole program. And so we were kind of stuck with not able to move forward in opening a program with just a percentage of the funding. And so this also happened to align with the Green Mountain Care Board telling University of Vermont Medical Center that excess funds from 2018 needed to be used for mental health community-based projects specifically. And so with that mandate from the Green Mountain Care Board, mental health urgent care was able to receive full funding for 3 years with funding through University of Vermont Medical Center.
Wow. Okay. So there's 3 years of funding
That's right.
secured at this point.
That's
Was
right.
any of this COVID-related funding, or is that do you expect that there will be a renewal of funding, that this could be a project that lasts longer than 3 years?
Yeah, so it's not COVID-related funding, and at this point, we don't think the current funding sources for the initial 3 years will be renewable. So based on how the program is funded, we don't have to charge or bill insurance, and we don't have to charge people for the services they receive at mental health urgent care, with one exception if people access telehealth medical services through community health center, that is billed to insurance. But other than that, the other services that are offered are free of charge for the first 3 years. But we are gathering information about what type of insurance the guests have of mental health urgent care so that we can do what we're calling shadow billing, like pretending to bill essentially to see what revenue we would generate and to see if that could help sustain the program beyond the 3 years. We're just in our first weeks of the program now, so we don't have enough data to know what the sustainability will look like. But once we can do some shadow billing for a number of months, we'll know what the gaps are and then what funding we would look to advocate for from potentially the state and from other resources.
And that's distinct from when folks show up to the ER, the plan is to bill insurance.
That's
in that
right.
case, right?
Yes,
Yeah.
and for most other Howard Center services, insurance is billed.
Right.
So this is really unique to mental health urgent care.
Yeah. When we talk about mental health, I think people have a lot of preconceptions about what that looks like. What are some of the issues that this program is intended to address?
Well, it's one of the reasons we say in First Call, they say the caller defines the crisis, that a guest can define their own crisis, because what a mental health crisis may look like for you may be very different for what it looks like for me. So if someone is experiencing symptoms of anxiety or depression, they're welcome to come to mental health urgent care for support. Someone might feel really overwhelmed for all sorts of different reasons. Perhaps they were in a conflict in their relationship with a family member, with a roommate, and they're just feeling distressed and needing support around that conflict. It could be that someone is having thoughts about suicide, or they're hearing voices for the first time, or they're just not feeling right, and they can't quite figure out what it is. Maybe they've seen their doctor. They know it's not a physical illness. And so for all of those reasons, someone can come to mental health urgent care to receive support. That's
incredible. How you mentioned staffing for a program like this. How is this staffed, and has that been a challenge to stand up staffing for this?
It was the thing we were most worried about as we did the legwork to create this program and then to open it. So to be able to operate Monday through Friday, 9 to 5, which are our initial hours of operation as we gain some traction in having this new program open, there are about 20 full-time positions. And at Howard Center, our vacancy rate for staff is about 16%. So we have a couple hundred open positions. And we were really worried that we wouldn't find staff for mental health urgent care, or that we would take staff away from one program to staff this program. And so we did our position design and our recruitment very carefully, and then crossed our fingers. And we had incredible applicants for mental health urgent care that were really attracted by having a new program that was in partnership with multiple agencies. So people are hired by their host agency, so to speak, but then are coming together in a really beautiful kind of community partnership or collaborative to work together for mental health urgent care, and that was really attractive to people. We had some candidates move here from other states or who have very long commutes from other parts of Vermont or across the lake in Plattsburgh that are really excited to be part of the program. So we were able to staff almost all of our positions. There are a few remaining, but the majority were staffed such that we knew that we could open on October 28th, which was our goal.
That's impressive. And speaking of staffing, so when someone walks in, can you remind me the address? It's on Prospect Street?
Yep, it's at 1 South Prospect Street, which is the UHC building, the building commonly referred to as UHC. Okay. So it's actually a building owned by the University of Vermont and leased by University of Vermont Medical Center. And so we're really happy that mental health urgent care can be embedded within this building because there are many different types of both physical health care and mental health care services provided in this building. And so we're hoping that that can help destigmatize walking into the building and asking for help and for services. And also will create some really nice connections to other programs in the building. So many people come to this program for their annual mammogram, for example, or for their blood work, if that's something that's required. And we're encouraging people to stop by mental health urgent care to check it out so that if they need it themselves or they have a family member or a loved one who might be in crisis, they have some visual familiarity with it to help talk about the program. There are also programs run by University of Vermont Medical Center like the Addiction Treatment Program and Seneca, which is an intensive outpatient program. And we can directly refer guests of mental health urgent care to those programs. And if they have patients in crisis, they can do a warm connection to this program as well.
Does this program involve addiction treatment, have resources for that?
That's a great question. So addiction treatment may be part of the crisis that someone comes in with. Someone may have used a substance for the first time and is feeling really overwhelmed about that or the implications that that may have had in their life. Or they may be ready to connect to treatment or to talk about what recovery may look like. So it's not a detox facility. It's not a public inebriate program, but if someone is struggling with their substance use or they want to talk about services and treatment, they're welcome to come to mental health urgent care to talk about that.
How is it typically staffed? Is it 24/7 or what are the hours?
So because of our staffing challenges in our community, we decided, we would love to have a 24/7 program, but we knew we couldn't operate that. At Howard Center, many of our 24/7 programs have significant staffing challenges. And so we wanted to stand something up that we were sure we could operate. So to start, at least for the first number of months, if not the first year or longer, we will be operating Monday through Friday, 9 to 5. And we're hoping that people may come to mental health urgent care earlier than they would go to the ER. We know there's a lot of stigma in mental health treatment and that it's incredibly vulnerable and hard to ask for help. And so often at the point where someone currently is going to the ER, things may be really bad in terms of symptoms or how someone is feeling. We're hoping by trying to destigmatize using services and having a beautiful therapeutic environment that someone may access mental health urgent care earlier than they would otherwise, so we can provide some preventative or proactive care as part of their treatment. So when someone comes to the program, there are a number of services that they can access, and the services are voluntary, so it's a voluntary program. So we have crisis clinicians who provide crisis assessment and brief intervention. They can also help do what we call safety planning if someone's having thoughts about suicide, hurting themselves or others, but they're open to talking about treatment and engaging in treatment and making a safety plan. We can help with that suicide care or crisis care, further assess the concern, connect to services in our community by making referrals, and then talk about a coping skills plan or a safety plan. We also have care managers who can help with those referrals. So if someone, for example, is interested in connecting to a therapist, they can help them figure out who may have openings or who takes their insurance. And if someone's looking for housing resources or other social service resources, the care managers can make referrals to that as well. Pathways Vermont has peer specialists, and we have a beautiful peer community room. So if someone's looking to talk to someone who may have gone through a similar experience from a peer-to-peer connection. They can access Pathways peer support. And then Community Health Center has a registered nurse on site. And then there's telehealth medical care available as well. So, and this is for medical care related to the mental health concern. So it could be that someone has questions or confusion about their medications, or that someone may have a physical symptom related to their mental health and they want to talk to a medical provider about that.
This can be really intense work. I'm wondering how the Howard Center approaches supporting its staff through what I imagine can be really, at times, difficult and intense interactions with some of their clients.
Yeah, we want staff to feel really supported, and staff feeling supported is an important tool in retaining staff. We're hoping the staff we just hired will stay a very long time in their roles at mental health urgent care. So we had, for the Howard Center staff, we had a 5-week training program, and part of that was learning about Howard Center and community resources, but part of that was also about self-care and wellness and really coming together as a team. For the staff, they receive weekly supervision, and there's a weekly staff meeting. There's lots of different training opportunities available. We encourage people to use their benefits, including time off. And we made a really intentional decision that mental health urgent care would be closed on agency holidays so that staff could have a break during that time. And it's also hard to operate a program when other programs in our community who we might be referring to are closed as well. So through intentional training, supervision and support, and then different wellness activities for staff, we're hoping that they feel like they have the support they need to do the hard work.
How would you characterize staff morale right now at the Howard Center? Across the center.
Across Howard Center? Well, for mental health urgent care, the staff are really excited because this is a new initiative. Through the funding, through University of Vermont Medical Center, the space that mental health urgent care is in at 1 South Prospect, it's the Arnold 4 suite, and it was completely renovated with a trauma-informed design. And so there are views of the lake and the mountains, and just the space itself feels incredibly therapeutic. And staff have commented that it feels really exciting to come to work in a place where there's high morale, and it just feels physically beautiful. I would say across Howard Center, it's challenging because of our funding limitations. We absolutely wish we could pay staff a lot more, and we don't have the funds to do so. And so instead, we provide wellness activities, again, supervision, support, training opportunities, and we have so many different programs across Howard Center. There are more than 50 programs. And so while we want staff to have a strong agency identity, they also have a strong program identity, and that's where a lot of the day-to-day support comes from.
You mentioned it's just been a couple weeks, but any early lessons learned, or do you foresee any evolutions of the program? You mentioned just a handful of people have been served thus far, but what are we learning? What are we hoping to learn from the first few weeks and months of the program?
Yeah, so one thing that feels important to mention as we think about destigmatizing mental health is that we're intentionally calling people guests who come to the program. Guests. So we're not using the language of clients or patients or service users, but saying guests. And so in our first week, we served more than 12 guests, served and supported more than 12 guests. Last week was our second week. It was more than 15. And then we were closed yesterday for Veterans Day. And so we'll see what week 3 will bring. I think one thing that's hard about crisis work inherently is that it's unpredictable. And so there was one day last week where we served 2 guests all day, and another day where we served 10. And we're happy for anyone to come at any point, but to not be able to know the volume means that staff have to be nimble and flexible, which is very much appreciated. The hours of operation, I think, are tricky in that we know that people have crises and need support well beyond 9 to 5. And so we're working with community partners we're working with partner programs internal to Howard Center, like our outreach programs and First Call for Chittenden County, but also external community partners to help figure out what a plan can be from 5 p.m. until 9 a.m. the next morning, when someone can come back and maybe receive more support.
How have you approached getting the word out, aside from coming here to Town Meeting TV? We appreciate that, but what else have you guys been doing to make sure that people are aware of this resource?
So we have had lots of social media, not just through Howard Center, but through our partner agencies. So Pathways Vermont, Community Health Centers, and University of Vermont Medical Center have done a great job promoting the program through social media. We had a hard hat tour pretty early on when the space was under construction and invited media to come to that to get an early look at the program. We've had 2 virtual town halls where a few hundred people attended. We were really delighted by that, to provide information and then answer questions from the community about this new program. And then we had a public open house the week before the program opened. We had great attendance. And we'll
What did you hear from folks at the, sorry to interrupt,
No,
what did you
please.
hear from folks at those?
Yeah, there's a
events?
lot
That's
of
amazing. That's a lot of people.
excitement. It's really unusual for a program to have full funding. It's really unusual for a program to have 4th floor lake views and to be able to have the incredible staff that we were able to hire. So there's a lot of excitement about this program helping to fulfill a gap in our system and in our community.
Yeah. How did you get the 4th floor with the lake view? What was there before? Do you know?
There were some administrative offices there before. So our goals for a space were that they needed to be accessible. We needed a space that was on the bus line, that would be accessible to wheelchair users and other people who needed a place that was convenient. So off of 189, that had free parking, ample parking, and where we could have really good signage and wayfinding. So we looked at a few different places in the community, and we were really excited when Arnold 4 at 1 South Prospect became available.
That's incredible. We've just got a couple minutes left here. Is there anything that you haven't mentioned about this program that you want to make sure that people know?
One thing that's really important to us in terms of our program values is that this is a program for everyone. So if you're in crisis, or you have a family member or neighbor or colleague in crisis, we really want to get the word out that this isn't a program for a certain population or for people who are already established clients of any one of the partner agencies, but that this is really for our whole community.
That's awesome. Charlotte McCorkel, who's the Senior Director of Client Services at the Howard Center and who is part of the leadership around the new mental health urgent care in Burlington. Thanks so much for joining us.
Thank you.
Awesome. Thank you for tuning in to Town Meeting TV. So long.